Hi, everyone. So I'm presenting on behalf of my classmate Natalie Liu, Dr. Malkoc, Dr. Nguyen, Dr. Nguyen, and then Dr. Toporoff. I'm presenting on bronchopulmonary fistula development in an elderly male with a COVID-19 infection. Can I have the next slide? Thank you. So brief introduction. As we all know, COVID-19 infections have been shown to cause various complications. In particular, COVID-19 pneumonia has shown to demonstrate many sequelae, including pneumothorax, pneumomediastinum, subcutaneous emphysema, acute respiratory distress syndrome, and bronchopulmonary fistulas in less than 1%. So a bronchopulmonary fistula is any abnormal communication between the pleural space and any of the main branches of the bronchial tree. And unfortunately, it can lead to morbidity upwards of 71% if it's left untreated. So in this case study, we're focusing on a case of bronchopulmonary fistula in a 77-year-old male who was eventually treated with a video-assisted thoracic surgery using talc-pleurodesis and a chest tube placement. Can I have the next slide? Thank you. So our 77-year-old male who only has a past medical history of hypertension, he initially presented in the ED for evaluation of flu and COVID-like symptoms. And he had been vaccinated twice with Moderna for COVID. He eventually developed a spontaneous right pneumothorax on the second day of admission. And this was confirmed on chest x-ray after the patient started complaining of shortness of breath without any chest pain or palpitations. As a result, a 14 French pigtail catheter was inserted and a chest x-ray was used to confirm re-expansion of the right lung. And the patient eventually was stable enough for discharge for home on day 6. However, the patient failed chest tube clamp trials. He eventually became tachypnic, tachycardic, and short of breath. Can I have the next slide? Thank you. So repeated chest x-rays and chest CTs confirmed that the patient actually developed a persistent air leak that was secondary to formation of a bronchopulmonary fistula. So meanwhile, the patient was responding very well to the COVID regimen, including medications and vitamin supplements. Eventually, the chest x-ray did show resolution of the pneumothorax, but pulmonology and cardiothoracic surgery were consulted, and it was determined that the patient would be a good candidate for video-assisted thoracic surgery with pleurodesis using talc. Eventually, the patient was able to achieve complete resolution of his pneumothorax, and as well as the air leak, and his recovery post-operatively was successful, and he was eventually discharged to a SNF. I have the next slide. Can I have the next slide? Thank you. So overall, conservative management was initially utilized with chest tube placement and suction. However, it was not successful. And due to the persistent lack of resolution and worsening condition, surgical considerations were imperative. The patient reported feeling more depressed because he had COVID and he wasn't able to see his family. And due to decompensation, he required surgical considerations for management of the persistent air leak. And talc pleurodesis was utilized since it had a 70 to 80% success rate. And overall, the treatment was successful. And I think that's it for this presentation. Thank you. If you guys have any questions, please let me know.
Sure, I have one quick question. Do you think that there's a standardization to check for fistulas in all COVID patients with respiratory symptoms?
Based on in our facilities at Arrowhead, so we had a lot of COVID-19 patients. However, this patient was actually our first patient who presented with a bronchopulmonary fistula. So there was actually not that I know of, we didn't have a standard protocol for checking. And it was only until that we were trying to clamp the chest tube that it was revealed that he ended up actually having a bronchopulmonary fistula. But otherwise, he he was doing initially very well in his hospital admission.
That's unfortunate for him.
Yeah.
Yeah, thank you so much. That was a lovely presentation.